Bipolar disorder is a psychological condition characterized by abnormal shifts between periods of overactivity and periods of depression. Our understanding of bipolar disorder has changed over time as psychologists and medical communities strive to understand, treat, and prevent the disorder. Like many diseases of the body and mind, bipolar disorder is controlled by many factors, including genetics and the environment. Understanding what roles genetics play in the predisposition of bipolar disorder is the next step in developing more effective treatments and better prevention. The recognition of people suffering drastic shifts in mood can be traced back as far as ancient Greece, where people first suggested that one disorder was responsible for the two extreme moods. The modern concept of bipolar disorder was not developed until the 19th century, when Jules Balaguer and Jean-Pierre Faller described to the Academy of Medicine in Paris, calling it dual-form insanity or circular insanity. It was not until the 1950s that scientists began to acknowledge the genetic component of the disorder, citing that it ran in families. Throughout the 1960s, many were institutionalized with this disorder, and it finally received its name, bipolar disorder, in 1980. Bipolar disorder consists of two main parts: the manic phase, a period of overactivity, and the depressive phase, a period of depression and reduced mood. Symptoms of the manic phase include little need for sleep, poor judgment, poor temper control, reckless behavior, including lack of self-control, usage of drugs, alcohol, sex with multiple partners, and excessive spending of money. Elevated, expansive mood, irritability, false beliefs, and often false consciousness. On the other side, bipolar sufferers also suffer depressive episodes with symptoms that can include low mood or sadness, difficulty concentrating, eating disorders such as overeating or anorexia, fatigue and lack of energy, hopelessness, worthlessness, and guilt, a loss of self-esteem, thoughts of death or suicide, and reclusive behavior including pulling away from friends or family. Some individuals suffering from bipolar disorder experience depression and mania together, while others alternate in cycles. Afflicted persons are at a high risk of suicide, drug use, alcohol abuse, and risky behavior that could cause harm to themselves or others. As of now, there is no cure for bipolar disorder, although it is treated. Medication and psychotherapy are most frequently used to control bipolar disorder. Psychological professionals track patients' mood and lifestyle to tailor drug regimens to control their symptoms. Commonly used drugs include mood stabilizers, antidepressants, and antipsychotics. Drugs including lithium are used frequently, but often upset the hormonal balance in the thyroid, which can relate to mood and energy. Additionally, electroconvulsive therapy is another treatment option. A patient is under anesthesia, and a muscle relaxant is used. An electric pulse is then delivered, and the ETC treatment is used in severe cases of bipolar disorder when no other treatment has been helpful. Even today, little is known about what defines the risk factors and predisposition for the disorder. Although bipolar disorder does tend to run in families, both environmental factors and genetics are at play. The Bipolar Disorder Phenome Database, a project created by scientists, links visible signs of the disorder to the possible genes that are involved, and also examines the interaction of genes with other afflictions, like depression and schizophrenia. While some genetic linkages have been found for bipolar disorder, it is possible that multiple genes are at play, and no strong genetic linkage has been identified. Additionally, many environmental factors have a heavy influence. While the disorder does tend to run in families, late teens and young adults are at a high risk of developing the disorder, and the lifetime prevalence is between 1 and 1.1%. Meanwhile, bipolar disorder is the sixth leading cause of psychological disability in the U.S., and as much as 20% of depressed patients have some form of the disorder. The suicide risk is significant for these patients, and 17 to 19% of afflicted individuals die by suicide. This disease and mental health in general. Major progress has been made as scientists have acknowledged that genetics is a factor. Bipolar disorder is a complex disorder that varies from person to person, and understanding bipolar disorder will require us to consider genetics alongside factors of the environment, while also being willing to overcome mental health as a society. For more information about identifying and combating bipolar disorder in your own life, please visit the National Institute for Mental Health at nimh.nih.gov.